Tracheostomy care. Trach care is done to keep our trach tube clean. This helps prevent a clogged tube and it decreases the chance of infection at the site. There are four main purposes of the procedure. First is to maintain airway patency. Second, to maintain cleanliness and prevent infection at the tracheostomy site. Third, to facilitate healing and prevent skin excoriation around the tracheostomy incision. And lastly, it is used to promote comfort. The materials that we need in tracheostomy care are the following. We need our suction materials, tracheostomy care kit or sterile supplies containing several cotton-tipped applicators, basins, brush or pipe cleaner, tracheostomy dressing, 2 pairs sterile gloves of appropriate size, 1 disposable clean gloves, disposable inner cannula that is the same as tracheostomy if available, normal saline solution, hydrogen peroxide, roll of twill tape or velcro tracheostomy holder, bandage scissor, towel or linen pad, overbed table, face shield or mask, plastic disposable trash bag. For the assessment, the expected behaviors are the following. First, we have to assess for signs and symptoms of the need to perform tracheostomy care, which include soiled dressings and ties, secretions in the tracheostomy tube, diminished airflow through the tracheostomy, or in accordance with hospital policy. This will help us to determine when to do tracheostomy care. And then we also have to assess the patient's respiratory status, including the respiratory rate, the depth, the rhythm, breath sounds, color, and pulse oximetry results as well, because this will help us to determine whether the patient can tolerate the tracheostomy care. Next, we also have to assess the tracheostomy site for purulent drainage, also for redness or swelling, because drainage, redness, or swelling may indicate infection. Then we have to assess the patient for pain, because if tracheostomy is new to our patient, pain medication may be needed before performing the care. Then we also have to assess for lung sounds and oxygen saturation levels. Lung sounds should be equal in all lobes with oxygen saturation of not less than 93%. Then we have to inspect the area on the posterior portion of the neck for any skin breakdown that may result from irritation or pressure from tracheostomy care. This will help us to prevent skin breakdown caused by the irritation of the tracheostomy tie or the pressure. Under the planning, we need to make sure that tracheostomy care involves the application of scientific knowledge, sterile technique, and problem solving, and therefore, it needs to be performed by a nurse or respiratory therapist. This is to ensure that the procedure is within the scope of nursing practice. Also, we have to gather all the materials that we need in order to save time and effort, which will facilitate the smooth implementation of the procedure. For the implementation, we have to identify our patient, because this is very essential in ensuring that the intervention is administered to the correct patient. Also, we need to determine the need for tracheostomy care. This is for us to have a baseline data and to anticipate if there's really a need for pain medication for this part. Then we also have to explain what we are going to do and the reason to the patient, even if the patient does not appear to be alert, because explanation to our client will alleviate fears, and even if the patient is unconscious, the nurse should explain the procedure. Then there is a need that we reassure our patient where we will be interrupting the procedure if he or she indicates respiratory difficulty, because any procedure that compromises respiration is really frightening for our client. Good morning, ma'am. My name is Jelly Mae Franklin, and I'll be your nurse for today. May I know your complete name and date of birth? Pink Bear, November 28, 1957. Great. Miss Pink Bear, how are you feeling today? Oh, good. All right. Well, Miss Pink Bear, I see that you do have some phlegm around your dressing that's oozing out. And with that, we may have to do tracheostomy care. Tracheostomy care is that basically a procedure where we are going to clean the trach tube to make sure that there is a good airway patency and you will be free from possible infection. So, Miss Pink Bear, the procedure will be a little bit uncomfortable But don't worry, because any discomfort, if you think that it is so unbearable already, we could always interrupt the procedure, because we want to make sure that you are going to be fine and comfortable. And do you have any questions about the procedure? None. Okay, well, let me go ahead first and listen to your lung sounds. All right, can you take a deep breath? All right, one more please. Take a deep breath. Okay, next, take a deep breath. And another. Thank you. Miss Sinclair, are you in any pain right now? Any kind of pain? No pain. All right. And then I would have to check your oxygen saturation. Okay. Now your oxygen saturation right now is at 92%, and there's definitely a need for us to do the tracheostomy care to make sure that the airway is patent, so you receive the right oxygen. Okay. Then we are going to perform hand hygiene. This is very important to prevent cross infection. And we also have to adjust our bed to comfortable working position. We can lower the side rail closer to us. Lowering it will facilitate good body mechanics in performing tracheostomy care. Now, if our patient is conscious, we can place our patient in semi-Fowler's position. If the patient is unconscious, we can place a patient in the lateral position facing the nurse, and we can place a towel or linen pad over the patient's chest. Now, the rationale for this is that semi-Fowler's position will help the patient to cough and breathe easier. Also, the gravity will facilitate suction catheter insertion, and the lateral position will prevent the airway from becoming obstructed, and it will promote drainage of secretions. Miss Pink Bear, I'm going to adjust you in a semi-Fowler's position where your back is slightly elevated, okay? Because this position will allow you to breathe better. Okay, there you go. And I'm going to lower the side rail. Then we have to move the overbed table close to your work area and raise the waist height. Place a trash receptacle within easy reach of working area. The reason for this is that the overbed table will provide us a work surface, and it will maintain sterility of objects on work surface. The trash receptacle within reach will prevent reaching over sterile field or turning back to field to dispose the trash. Then we also have to put on our face shield and mask, and here we are going to don sterile gloves. Now, using PPE will prevent contact with contaminants, thus preventing infection or cross infection. Then we are going to suction the tracheostomy tube following a septic technique. We are going to remove and discard our gloves. Suctioning here helps to clear the tracheostomy of secretions that could occlude the outer cannula after the inner cannula is removed for care. Okay, so we are going to place our tracheostomy care equipment on the overbed table, and we're going to prepare the equipment using sterile technique. The rationale for this is that this will help maintain sterility during the tracheostomy care, and preparing the equipment before beginning the care will ensure efficiency. The very first thing to do is we are going to open our tracheostomy care kit, and using pickup forceps, we are going to arrange the sterile tracheostomy care kit and separate basins. If it's not available in the kit, then we have to open 2 sterile basins separately. Basins are sterile receptacles for cleaning solutions. So we are going to open our tracheostomy kit, and using our pickup forceps, we are going to arrange the sterile tracheostomy kit and separate the basins. if it's not available in the kit, then we have to open 2 sterile basins separately. The reason for that is that it will help maintain sterility during the tracheostomy care, and preparing the equipment before beginning can ensure efficiency. Plus, the basins are sterile receptacles for cleaning solutions. Now, in this case, what we have right here is basically a receptacle with multiple sides already. I'm going to set up our sterile field right here. And I can leave the others here because this field is also sterile here. So what we're going to do first is that we are going to fill in one basin with hydrogen peroxide. Hydrogen peroxide helps remove dry and encrusted secretions, or the hardened secretions. So, alright, basically we're going to get our packs of hydrogen peroxide here. We're going to fill this basin here, the 1/2 portion. This card, and then sauce. Use this too. This card, okay. Now after that one is that we are going to fill in the other basins with saline solution. So we have here the 1/4 basin, 2 1/4 basins. Okay. Now, saline rinses and removes hydrogen peroxide, and it lubricates the outer surface of the inner cannula for easier reinsertion later on. We are going to open our sterile brush or pipe cleaner if they're not available in a cleaning kit. In this case, our sterile brush is available in our kit, so there's no need for us to open. Our sterile brush right here, or the pipe cleaner, will provide friction to clean the inner surface of the cannula later on. And then we are going to open the 3 4x4 gauze packages. We're going to wet the gauze in one package with hydrogen peroxide, wet the gauze in another package with normal saline solution, and then keep the third package dry, because we are going to be using the third package of gauze to dry the skin around the tracheostomy site after cleaning. So in here we don't need to open because it's part of the kit. Okay,